how many people do you see that you suspect are magnesium deficient?
Oh. Well, how many people do I see that are stressed?
Yeah.
90%.
Oh, okay.
90% of the people I see have a lot of stress.
Yeah.
So I would say for the most part, most of them would be at least have some mild magnesium deficiency. And like I said, I probably prescribe magnesium for most clients. So because everyone can benefit from it, no matter what.
Yep.
So so that's usually my first stop is magnesium. Everyone can benefit from the magnesium.
Welcome to the ATP Project. You're with your hosts, Steve and Nicole. And it is now, I know this is a recording, but it's 2024 for us.
It is 2024, I know. Hey, how quickly did 2023 go?
I don't know, too quick, but I'm getting too old because I'm going to be 55 this year now.
Yeah, well, I'm going to be this year.
Yeah, I know.
But you know what? This is my theory. When you're younger, that light, the light at the end of the road is very, very dim.
Yeah.
But then when you hit 50, suddenly it's quite bright.
Because you're dying quicker.
Yeah, and I feel like it's coming up a lot quicker. So it feels like time is going much faster when you're older. Because when you're younger, you can't wait till you're 16, then you can't wait till you're 18, then you can't wait till you're 21, and then suddenly you're going to, I'm going to get engaged or married, which, some of us never did. And then, so you're always looking forward to something. But then when you've done all that, what's left?
What's left?
So you kind of,
death.
I mean, there's plenty left, death. But yes, that's coming from a 50-year-old.
And it's funny because today's topic, we're talking about a supplement that can actually help with our brain and our heart, the two things that fail as we get older.
Yeah.
Well, good intro, Nick.
Good intro, I know. And it's one of the most widely used.
Yes.
And probably one of the most essential.
Yes.
Nutrients.
Yep.
And one of the most depleted nutrients.
Yep, Australia's a shit at this level of this mineral. So I'm giving you a little hint.
Little hint.
Mineral.
Starting with magnesium.
Magnesium,
yes.
Of course.
Just put him in another misery.
God, I almost forgot what we were talking about. Amazing magnesium. I mean, and today we are talking magnesium, a bit about magnesium, but mostly we're talking about two special forms of magnesium.
We are. We have some very cool. Look at the paper, the pile of papers. It's like a phone book of studies on these two particular forms of magnesium.
Just two forms.
Yeah.
And it's funny. It's forms that you won't find too often in the shops.
No, they're not widely used or widely known.
But we love them.
We love them, and they have some amazing actions and benefits in the body.
I know. We'll talk about the first one. And which one do you want to start with?
Would you reckon we should talk about what magnesium does in the body?
Oh, yeah. Let's start with magnesium.
Let's set the scenes,
and then we'll get these two forms, and then we say why these two forms are the best to take.
Yes.
And along with other forms. There's not really, there are some bad forms, but yeah.
There are a few bad forms.
So enzymes in the body are the things that make the body work. Magnesium is involved in what, 3 or 4? How many?
Oh, look, they say 3, but it could be 300 to 500 different enzymatic functions in the body. So there's a lot. Magnesium is needed for a lot of these pathways.
What are the terms you use for? What about my muscles? Like I know I look like Chris Seabum, but
you always say Chris Seabum. Can you say someone like The Rock that I know?
You don't know Chris Seabum, the 5 times Mr. Olympia body shape guy, good looking dude.
Sorry, no.
You must have looked at him.
You've probably shown me, but I don't. No, I don't. No.
Oh my God, I think he's hot.
Do you, Steve?
Yeah. I'm not into the guys, but he's pretty good looking.
Well, I'm sure he's good looking, but no, I can't set the reference.
Oh,
but when you say The Rock and I look at you, Steve, I think, of course.
Well, I've got the haircut of The Rock, sort of, almost.
You too. It's like looking in a mirror.
Yeah. We're both, well, I'm bald. He's
bolder than you.
Yeah, but is he shave or is he?
Yeah, he shaves it. Yeah.
Oh, okay.
Yeah, I think there comes a time when you got to bite the bullet.
I'm going to get a comb over.
I think you're okay.
I'll tell you, Steve.
When it's time.
Oh, okay.
When it's time. But yes, protein synthesis.
Yes, that's it. That's what I was getting at.
That's where we were going with that. Yeah. It's involved in protein synthesis, muscle and nerve function.
Of course it is.
Blood glucose regulation.
Yep.
Blood pressure regulation.
And that's what most people know it as sort of a relaxant, and it does relax the muscles. And we're going to talk about blocking calcium channels, which is a bit later on, but it really does regulate the body by blocking calcium channels, so it's really good.
Yeah.
So what else is it required for? What about my energy levels? Help that?
Yeah, it helps with energy production.
Yep.
So it helps with oxidative phosphorylation.
Oh, Jesus Christ, phosphorylation. What happens when you phosphorylate something?
Well, you can tell us all about
All right.
it, Steve.
You know the name of our company, ATP?
Yeah.
It doesn't stand for adenosine triphosphate. But
That's what everyone used to think that it stood for that.
But ATP in the body is energy, and the P stands for phosphate.
Yep.
And when you break off a phosphate, because there's triphosphate, tricycle has 3 wheels, so you break one off and you release energy. So that's what actually gives us the energy. Phosphorylation is putting that phosphate group back on. Like creatine that I'm drinking now puts the phosphate. That's why I'm full of energy now. I'm feeling really good. So really good.
Buzzing in the
And
podcast
it's good for glycolysis and heaps of other things too, and for the bones and for the DNA and RNA. Pretty much does everything in the body. Cooks your breakfast.
It's just about cooks your breakfast.
I know.
Yeah. Does just about everything else.
So if this mineral's so important, how much have I got in my body?
About 25 grams, Steve.
Grams?
Yeah.
Oh, 25 grams.
25 grams.
That's a lot.
It is a lot.
That's a fair whack of magnesium. So it's floating around the system somewhere, doing all these 300 enzymes and making more muscle. And it's hard to believe it's making more muscle on me. But
Well, I mean, you must have more than 25 grams.
I must have 250 grams of this stuff.
Must have.
I do that sort of thing. And it's funny because you go to the doctor, you can get a blood test and that sort of thing, and they measure how much is in the blood. But of that 25 gram, what percentage is actually found in the blood that they're testing?
Well, 50 to 60% in the bones.
Yep.
And the rest of it's, and then most of the rest of it is in the soft tissue.
Yep.
So what's actually flowing around in the blood is actually not much.
Yeah.
And so when
About 1%.
yeah, and so when people say they get their magnesium tested on a blood test, I say pretty much don't even look at it.
Yeah, I know.
It's not accurate at
You can
all.
get red blood cell magnesium levels, which are a little bit more accurate.
A little bit
but
more,
it's only
yeah.
small percentage. So okay, so I've got my dodgy blood test. What levels should it be?
Well, I see it at 0.8 pretty much across the board. It does not move much from that.
So the range is 0.75 to 0.95, and it's always 0.8.
So a lot of people say, but my magnesium's low. And I'm like, no, it's really not. But,
Nah.
Well, we don't look at this as a marker of it being low, because pretty much every blood test I see, and I see a lot of blood tests, it's 0.8.
It's amazing, eh?
Yeah. So
All
it
right.
just doesn't give you actually an accurate picture of your magnesium status.
No.
So no. So
All right. So why do we need it every day? We need it 350 milligrams a day, according to the RDA. How do we lose it?
well, I'll tell you, one of the biggest ones that most of us have an issue with is stress.
Stress?
Yeah.
None of us stress.
No.
No one stresses in
No
this
one
world.
stresses. No one stresses.
God.
Stress is really depletes magnesium quite significantly. So if you have a lot of stress, you probably are quite a little bit deficient in magnesium. A poor diet, so highly processed foods and things like that, obviously not going to get your magnesium in if you're not having fresh vegetables.
Well, it's
like
found
that.
in your green leafies and your salmons and also your nuts.
Yeah,
And we're right with nuts, aren't we?
we love the nuts, Steve.
Oh, I ate a lot of them.
How far in are we before you did a nut joke?
Well, it was 5 minutes in.
5
It's
minutes in.
2024.
That's nearly a record.
But it's funny, I gave the guy behind the camera a big lot of nuts before.
Yeah, you gave Vanessa some nuts.
He's loving them.
He's loving them. Yep.
Oh, joke, that didn't get...
You can't hear what Matt's saying behind the camera, hopefully. Anyway, alcohol is another big depleter of
Australians
magnesium.
don't drink. What are you talking about?
No.
We never
Any
drank over
Australians
Christmas
drink.
or anything? No,
nothing
so
like
forget that one.
No. Even coffee.
Coffee?
Can deplete it, yeah, coffee.
Wow.
Soft drinks or sodas, if you're in America, that's they can deplete it as well.
Ugh.
Heavy metal exposure,
Yes.
which is more common than you would actually think. I do see arsenic is another big one. People eat a lot of rice.
Rice and smoke a lot.
Yes.
Smoking pumps up. Ah, that's interesting.
Yeah, so that's another one. Medications.
Oh, give me some.
PPIs.
That's
so
a proton pump inhibitor.
inhibitors.
Yep, antacids.
Yep. The oral contraceptive pill.
So the pill, yeah.
That depletes a lot of nutrients.
That's what I'm on, yep.
Yep.
Hey, don't laugh.
You
I'm
don't
not
want to get
pregnant.
pregnant,
I'm
Steve.
not pregnant.
You don't want to be an old
You don't
parent.
think men can fall pregnant? We're going to get
I've
into a
seen
massive...
twins, Steve.
Oh, yes, that's right. How do you remember that movie? That was
Because
like...
I'm old, Steve. That's my era.
That's my
That
era
was when
too.
Arnie was still young. Now
Arnie.
Arnie's like 80-something.
The famous line from that one. Oh, no, it's a different one. I was going to give a line. It's not a tumor, but that was from Kindergarten Cop. Oh, what an
No,
idiot.
that's a bit of a-
I would have got some emails about that. So lucky I didn't
You're
stop
lucky you didn't
myself.
say that, Steve.
Yeah.
Lucky you didn't say it. Antidepressants.
Everyone's on
Everyone's
antidepressants.
Antihypertensive, so blood
Yeah.
pressure medication. And here's one for you that a lot of people have taken is antibiotics. Yeah, so they can all deplete magnesium.
They're probably the most common medications around.
Yeah, they are. So so they a lot of depletions there. And this is another one, particularly in Australia, is depleted soils.
Yes.
And that's a big problem with selenium and magnesium and
Yep.
a lot of our essential nutrients are quite depleted in our soils these days.
I know, and you know, you got to eat your leafy greens. They grow in soil.
So they grow in soil.
And you got to remember the year before they took the crop off that with all the magnesium off that. So eventually the soils just become depleted.
Yeah. So I mean, even if you are eating a really good diet and high magnesium rich foods, it's quite stressed.
Yep.
Or you're taking medications, or you drink a bit. You're going to be depleted in magnesium.
It's amazing. So what are the things you got to look out for? What are the symptoms? Some of the real for severe magnesium deficiency.
Yeah. So you don't really get a lot of symptoms if it's mild. It is more severe.
Yeah, blood pressures and stresses and that. But
yeah. So cramping.
Cramping, yeah.
And that can be sort of more moderate sort of depletion, more than severe depletion. Loss of appetite, nausea, vomiting, these are quite more severe depletions. Weakness, abnormal heart rhythm is one, because obviously magnesium is involved in cardiovascular function as well.
Oh, yeah.
Numbness and tingling. And here's one for you, Steve, vitamin D deficiency. So, but you need magnesium to help with vitamin D status. If you are low in vitamin D and you supplement and you can't get your levels up, have a look at magnesium, because you could well be depleted in magnesium.
Wow.
And if you bring in the magnesium and get your levels up, you can find that the vitamin D will go up. Yeah, so that's an interesting one.
So vitamin D you can supplement in your diet and also get it from sunlight.
Yeah, you can get it from sunlight. You know, supplementation as well is very cheap and easy.
So the people are freaking out now. What are who are the types of people that you should be worried about with magnesium deficiency?
The chronically stressed population. That's like one of the biggest ones. So people who have a lot of stress and it's quite chronic, they will be burning through it as well. Type 2 diabetes, insulin resistance, those types of populations as well can be depleted because they have an increased urinary output.
Yeah, because we lose about 120 milligrams a day standard, and these guys just lose more. So, and type 2 diabetics, and I'm not speaking for all of them, but a lot of them have a very poor diet.
A lot of them do, and that's how a lot of them, not all of them, have got to the point of being type 2 diabetics or insulin or metabolic syndrome. Alcoholics, because it depletes it.
It really depletes everything, doesn't it?
Yeah, it does. And even older adults.
Like me.
Like you, Steve. You're definitely in that population, because of malabsorption in the gut.
Everything gets shittier as you get older.
Yeah. And people who sweat a lot, I mean, it's not obviously you're losing all your electrolytes, but magnesium is part of that.
Yeah.
Probably athletes or people who do a lot of exercise, and that can deplete, you know, that's stress. That's a stressor in itself.
Oh, yeah.
So making sure your magnesium stores are good there. So there's some of the people that can be depleted.
So it's remarkable, isn't it? That's pretty much everybody's got to be worried about this.
Pretty much.
It really is.
I think in this day and age, this would be one of the minerals that I do pretty much prescribe it with most people.
Yeah.
So that most people can benefit from it, even if they're not hugely, significantly depleted. Mild depletions can still be a factor. As we'll talk about, it's very good for nervous system function, so it's good for that stress, you know, all of that sort of thing. So, most people can benefit from magnesium.
I mean, I supplement it, but that's just, you know, there's probably, of course you take it. But I do.
Yeah.
And I have, before I started working here, and I have since the 90s.
Yeah. I've been doing it for over twice a day. I take it.
Yeah. Yeah, but I take it twice a day. So it's quite remarkable. And there's been some really cool studies on magnesium. It's used as a medicine in hospitals.
Yeah.
It is classified as compared to triptans, even strong morphine agents, it's one of the most effective things for bad migraines and headaches. And what they do in hospital, they hook you up to an IV of magnesium sulfate they use. They don't really care about the form because it gets in, it goes, they put it straight into your veins. And one study that from 1996, which made this, published in Headaches, imagine that journal.
What a headache to have to read that.
It's been around forever.
Has it?
Can you remember headaches and migraines have been around for ages? And
I used to get migraines when I was a kid.
Yeah.
That was a long time ago now.
Oh, yeah, I get them. And very rarely these days, but if you had a migraine or a headache, anything really bad, and they did a study here, and what they did was they took these people that were getting headaches. Mean age was 38, so they got a bit of grant. The 40 patients, and what they did, and they had different things. They had migraines, they had cluster headaches, which is the worst type of headache, all sorts of other tension type headaches, and chronic migrainous tension. So they got the worst of the worst. And they hooked them up with, when they got one of these attacks, they hooked them up with this IV, and 80% of the patients within 15 minutes of the infusion had complete elimination not better, complete elimination of the headaches.
Wow, that's awesome.
Isn't that remarkable?
It is remarkable.
So you think about the drugs. They give the ergots, they give the gepants, they give the calcitonin-related peptide monoclonal antibodies. This is the most effective medicine because no other medicine works that quick, and it's magnesium.
Look at that. See?
And remarkable.
It is remarkable.
And of the 20% that didn't really sort of, they improved but didn't improve within 15 minutes, they found that they had adequate levels of magnesium.
Well, there you go. So you have to have this effect, you'd have to be quite depleted.
Yes.
Yeah.
And so it's an alarm bell that your brain is depleted in magnesium.
Definitely.
I mean, 300 enzymes, it does all sorts of things. And the best form of magnesium for your brain is magnesium-threonate.
Yes.
And that is a really cool, that's one of the two forms that we're going to talk about today. And what I did was I immediately then said, okay, well, let's look for magnesium-threonate for migraines. And there hasn't been a study on it.
Yeah.
Because it's a relatively innovative type of magnesium.
It is.
It's not that well known about.
No.
But it's really good for your brain.
Really
it
good
crosses the blood-brain barrier and gets into your brain.
Yeah.
Absolutely remarkable. So there is... there's lots of data on getting magnesium into your brain. Now, what happens in your brain is that when magnesium is there, you know how it's the relaxing thing?
Yeah.
So magnesium-threonate, I give to people to help them sleep. Like my wife, after a nursing thing, she takes some of that and it helps her sleep.
Yeah.
Because it just settles your brain. It's like some of the other magnesiums that help your brain, the glycinates, and nothing wrong with them.
No.
But the threonate gets into the brain.
Yeah.
And that really does help you sleep. So when magnesium is in your brain, it blocks the release of calcium in your nervous system, and that stops calcium triggering the release of this calcitonin-related peptide chemical that's the enemy of everyone with a migraine, and that causes vasodilation in the brain and squashes your brain.
Yeah.
And the meninges becomes extraordinarily painful. That's what a migraine is. So magnesium is extraordinarily beneficial for anyone with that, and the threonate form is the best form.
It's the best form.
So really, really good one. I've got another paper here I won't go through talking about magnesium, but there's a chart that on page 3 which shows you what happens in the brain. I'll have the camera, Matt can probably put it on the screen and everything like that. But it's that one there, and you can see how magnesium just if you've got normal magnesium, the innovation is way less on the brain. But if you've got hypomagnesium there, you can see that it just triggers the brain and smashes it, and you get this. Look at that picture for someone with a migraine. See the hemi face?
Oh,
migraines are on one side of the face. So that's you typically get the tension headache across
I just
the top.
get on the left.
Yeah.
I only ever the left.
Yeah.
Yeah.
And the cluster headaches in this, they get them around the eye. And the eye feels like it's too big for your head.
Well, that's what I get. I get it. I don't anymore. I used to get them weekly when I was a kid, but I've since correlated them with histamines. So I haven't figured out the histamine issue with me. But probably weekly. Yep. And they're in behind my eye and all this side of my head. And it would literally, to the point where I would be 24 hours, 48 hours locked in a dark room with a bucket because I would vomit. Noise sensitivity, light sensitivity. It's horrendous. So anyone that says they've got a migraine, some people say, my head hurts, I've got a migraine. I'm like, is it a migraine or is it a headache? Because if you had a migraine, you wouldn't be standing
You
upright.
lock yourself in a dark room, you get a cool towel across your eyes, tie it up tight because tightness helped me, and you'd even put towels under the door so the crack of light.
Not even a crack of light. Like, not even a noise, anything like that. So they're horrendous.
And someone asking you how you are, you just want them to die.
Yeah.
So it's a real interesting disease, but it affects 18% of women.
Yes, it does. I mean, there's a lot of it around the cycle. Yeah. But then, I have my theories around that with the cycle, with estrogen, with histamines, and then histamines and the headaches and the migraines. So
progesterone, if it's depleted, of course, that gets rid of histamine. Yeah. Interestingly, if you went to your GP now and you say you're getting migraines, there's a preventative for it now. It's called San Migraine, and that's an antihistamine.
There you go. See, my mum used to give me. My mum listens to this. She loves it when I talk about her, because
You've said some funny things about your mum on this podcast.
I know.
Or was that off camera?
No. I told her about because we talked about her guide dogs in the previous one, and I told her that, and she thought it was hilarious. And I said that the guys didn't think it was that funny that your guide dogs were trying to run you into cars and stuff. And she's like, "Oh no, it was funny." No, I have said a few things that Mum's corrected me on, that she taught me that I didn't credit her for. So I'll credit my mum again. When I was young, she's very forward thinking. So she used to give me feverfew every day as a preventative. Wow. Which is a herbal medicine to help prevent them. Yeah. So I used to have to crush it up and put it in a teaspoon of jam because I couldn't swallow tablets.
It's called tennessine and parthenium. Yeah. It's a fantastic, one of the major herbs for prevention of migraines.
Yeah, but interestingly with the drugs that are antihistamines, so there is a very strong connection between
the problem with that, of course, is when you deplete histamine out of the brain, you actually get so fatigued with these drugs and your appetite increases dramatically. Yeah. So people are expected on these drugs to put on 10 kilograms every 6 months.
Yeah, great.
You imagine that?
It's great.
Don't worry about your head. You get a heart attack and die.
I'd rather have the migraine.
Can you believe that? It's like, wow. So, I mean, you know, so with the magnesium-threonate, there's some really interesting data on it, and they do a lot of mice studies. Yes. Because you've got to remember that the brain, you know, you can't sort of stick a needle in your brain and measure it.
And any vegans and animal activists, just turn your ears off, because we don't agree with the fact that they do it on the animals, but they do. And we have to read the studies because this...
No.
But yes, sometimes that's whether or not it's anyway. Let's move on with that.
You're either going to cut a human.
Mice.
You've got to cut a human's brain open or a rat's brain.
Well, I mean, ethically, I guess yes. Yeah, it's probably a rat.
So what they did with these rats, and again, was they gave them magnesium-threonate. And it elevated the magnesium level in the cerebral spinal fluid, so the measure, and they attenuated motor defects caused by dopamine problems. So they gave these rats Parkinson's. And then they gave them the magnesium-threonate, and it normalised their brain function. Quite incredible.
Isn't it?
Yeah.
That is amazing.
I know. So it definitely increases the cerebral spinal fluid because, again, measuring that, you know, is terrible. You have to give them a lumbar puncture. Yeah. In humans, so you have to give them in rats and that sort of thing. Yeah. So it attenuates the motor defects in dopamine neuronal loss. So it really, really helps the way your brain works on this one. So really fascinating study. This was published in the Neuropsychiatric Disease and Treatment Study. So very interesting.
Yeah.
So can we stick on the rats for a bit?
Yeah, let's stick with the rats.
Okay. So what they did was they orally gave magnesium-threonate. Now, people say, how do you give rats tablets? You just put in their water. Yeah. That's what they did, and they measured how much water they drank. Yeah. So what happens is when you take certain medications, like chemotherapeutic medications, they dramatically cause memory loss. And you'll see people that are on medications that their memory is shot down. They said, it's the meds I'm on. So oxyplastine is a terrible memory screwing up drug. And it's a chemotherapeutic drug, so it has terrible other side effects. But basically you lose your mind. You become, you know, you forget everything. Yeah. And people know that with medications, even benzos do that, the classic, you know, even, you know, any neuroactive drug. So what they did was they gave these rats this drug, and then they gave some of them the magnesium-threonate, or they gave some of them a placebo. And what they found is the rats that they gave the magnesium-threonate to, their memory was preserved. And the other rats, their memory was screwed. And they had a mechanism here, and it normalised tumour necrosis factor and neurofactor kappa beta, which is a terrible inflammatory chemical. So it's actually anti-inflammatory, particularly in the brain. Nuclear factor kappa beta is the main driver of inflammation in the body. So, I mean, how incredible is that? I mean, and you know, people going through chemotherapy and that type of thing, sometimes it's very hard to give supportive supplements and nutrients and things like that because of contraindications. Yeah. So, but with the magnesium, there really isn't a lot of contraindications. Obviously, you always check with your doctor. But you know, that if you can help alleviate some of that memory issue on top of everything else that's going on, how amazing is that? Well, it's going to get more amazing for you. Tell me. Because you know how it blocks tumour necrosis factor, the chief driver of inflammation. Yeah. People with neuropathic pain, so these are the people like my mother-in-law has got terrible sciatic pain. She gets it down her leg. You know, it stems from her back. A lot of people have these conditions and they end up with spinal fusion. They end up in strong medications. The most common one they get for neuropathic pain is gabapentin, which is a powerful medication that a lot of people are on for nerve pain with opioids. So they combine them both together. So pretty tragic. And what they did was they found that when you are in incredible pain, your memory fades as well. You can't think straight because you're in so much pain.
Yeah.
Well, magnesium-threonate prevents, and I'll read the title of this paper, Magnesium-L-threonate prevents and restores memory defects associated with neuropathic pain by the inhibition of inflammation, basically. So it restores your brain after the pain.
Wow.
It kind of rhymes.
Yeah.
Yeah, I was a psychopathic
song out of
poet and I didn't even know it. So I mean, isn't that remarkable that we're treating pain conditions with a magnesium supplementation?
Yeah.
I mean,
and pain creates a stress response in the body as well. So it's also working on that nervous system factor as well.
That's
so
true.
that combination is just really beneficial because I have seen people in pain, and I had a footage a few weeks ago that I was in pain, extreme pain.
Are you going to talk about this?
No.
Oh.
but I was in extreme pain, and I was shaking from the pain, not shaking like it was involuntary, but it was my body's response to my nervous system's response to the pain. So the nervous system is highly activated when you have a lot of pain as well. So, having that extra effect of that nervous system support is really important as well.
Remarkable, isn't it? So that's incredible. And of course we've talked about it in rats, but in humans, what happens in humans? Well, there was a great study, and it was pretty recent. This one, this was published December 22. And what they did was they gave a formula with magnesium-L-threonate, and so it combines well with other nutrients. And so they gave this magnesium-L-threonate with phosphatidylserine and vitamin C and vitamin D. And they gave these to adults with cognition defects. And they found that the group of those nutrients improve dramatically the cognitive function in healthy adults. So even if you've got none of these shitty conditions and all this sort of stuff, if you want to improve your cognition, magnesium-L-threonate is one of the keys to it. Now, phosphatidylserine, great for that too, and C and D.
Phosphatidylserine is great, but phosphatidylserine works on reducing cortisol. So that's going to be doing that, but that's the magnesium's working on that brain specifically.
I mean, it's just quite remarkable. But it gets better.
Yeah, no,
because
get better.
There's heaps more. One study here, a pilot study published fairly recently, it's called Magnesium-L-threonate supplementation for ADHD, and what they found was that it was found to be effective and very, very, very effective for ADHD. So I mean, this is only a small trial where they only had 15 adults with ADHD, so they could get permission, that sort of thing, pretty easily. So what they found was that nearly half participants met the definition of ADHD symptom clinical response. So about half of them improved just on magnesium-L-threonate, which is pretty remarkable for ADHD.
It is remarkable. I'm actually looking at trialling this in clinic now.
Oh, really?
Yeah, so that's going to be interesting. So, I mean, I see a few ADHD clients. So, any sort of brain conditions, I'm really going to start bringing in the L-threonate. So, here's another one here from the World Journal of Psychiatry.
Oh,
Steve-o.
Tell me about Psychiatry
I'm going to give you this one to read because the words are too small for me to see. Which one's that one? It says it exhibited neuroprotective effect against oxidative stress damage and Alzheimer's disease.
And did they hurt rats in this study?
Oh, I think they did.
They did.
Yeah.
They did. So if you want to bring it up, that's fine. I was going to let this one slide.
We can just talk about how the L-threonate actually did help with Alzheimer's and oxidative stress in the brain. There's
in oxidative stress in the brain, you get the HT22 cells being damaged. Okay, these types of neuron in the brain. So what they did in this particular study was they gave rats Alzheimer's disease, and they do that by usually giving them a big dose of aluminium, which is a bit of a worry, isn't it? Because there's things that we consume that have high in aluminium.
Well, I mean, that's what they say a lot of times with aluminium can be a contributing factor. So
absolutely,
you've got to watch aluminium that's in your environment.
Yeah, so what they did was they gave these mice this magnesium-L-threonate, and it protected against the oxidative stress in the brain. So, I mean, that's because of the magnesium reducing the stimulation, but also the threonate getting it there. The magnesium's got to get into the brain.
That's right. And this is one of the best ones to get into the brain, to cross that blood-brain barrier.
I know.
Yeah.
Incredible. So, but going back to keeping on the. Do you want to keep on the animal thing?
Well, unfortunately, most of them are animal-based studies, so we.
All right. Well, I'll give you this one. This one's not that harmful for mice. What they did was they got these mice pissed.
Well, that would probably be fun for
They
them.
put alcohol in their drinking water.
Oh, they would
Can you
have loved
believe
it.
that? Is that allowed? Must be allowed.
I don't know.
Must be allowed.
No, I don't
so
think
they
anyone asked the mice.
they got the mice drunk. That's a bit worrying.
What do mice do when they're drunk, I wonder?
I don't know.
Do they go out and, harass
Cause
other
fights.
mice or cause fights or start a brawl on the corner street
I
or
probably do, but
fight over the mouse wheel?
But I know what they did was they couldn't find their way through the maze. That's one thing they do when they're drunk.
They
They
got
can't
backed up.
They got backed
Caused
up
a
through the
traffic jam.
maze.
They got confused.
And what they found was that
I just
normally
had the picture of a drunk mouse on the wheel.
falling off.
Sorry.
Yeah.
That's just my brain.
But they're trying to get through the maze, and normally they learn because they go, oh, it's not that way, it must be this way. Oh, okay, go that way. Now, if they're drunk, they go, oh, is it there? No, try there again. Oh, no, it's not there because they're pissed off their brain, so they're not very good. But
We've all been there, Steve.
Yeah, I know. It's a long time ago for me. So I haven't been drunk for years.
No, I don't think I've drunk forever. Actually, I've never really been a drinker. Who am I kidding?
No, I was a heavy drinker when I was, not heavy drinker, but
Well,
I
you
was.
were a muso, Steve. It comes with the territory.
I wasn't really into the grog then. We did shots and that and stage and did silly, but I never got blind drunk. But you got to remember that when you're drunk, you don't learn too well. So these poor mice, when they got them drunk, it did two things to them. It caused gastric irritation and it caused them to not get through the maze.
Yeah.
They gave some of them the alcohol and the L-threonate, the magnesium-L-threonate, and their gastric irritation reduced dramatically and their maze skills went back to normal.
So even though they still had alcohol on board, adding in the threonate, magnesium threonate, it did alleviate those factors.
Correct.
And how amazing with the gut.
The gut.
Because alcohol is horrendous on the gut.
Now, I've got a picture here.
Is that the rat
This
picture?
is the rat
Another
picture that you liked.
I loved it because look at the little rats. So
And
cute.
this is from a journal, so we didn't paint it. But
The one on the left looks evil, but the one on the right looks like he may have had a drink.
that one's drunk.
Oh, is he drunk?
Yeah, see
He just looks
alcohol?
evil.
See it written alcohol? And this guy's got his thumb up.
So he looks.
And that's the alcohol and the
The
magnesium
one on the
threonate.
right just looks like you can't trust him. He's got a bit of a look about him.
He's drunk.
Oh,
He's drunk. Yeah, that one there is drunk.
okay.
This one's drunk, but he's got a magnesium L-threonate on board.
So he's super happy.
Yeah.
Yeah.
So what they found was that when you have alcohol and magnesium threonate, you're not going to believe this, it increased good bacteria in the gut.
Wow, look at that.
Like
So
one
that
of
is
them,
really amazing.
Akkermansia. You know,
Well,
fans of-
Akkermansia is
yeah.
really needed for the
and
butyrate production.
Yep, absolutely. And on the other side, if you just have alcohol, it increases Clostridium in the gut. Because remember, drinking is
Clostridium is not good, people.
yeah,
A lot of it.
You got to remember that this is really, really, the gut is so important for everything.
Yeah, well, we've talked about the gut so many times.
So these good bacteria in the gut, it did two things. The good bacteria increases glutathione, superoxide, antioxidants, and reduces inflammation. The bad bugs on the other side, just drinking alcohol drives all those things the opposite direction than you want.
Yeah.
So it drives up inflammation, drives down superoxide and antioxidants. Another thing it does is the bad bugs block amino acid metabolism. So glutamate metabolism changes and you therefore can't get any memory and learning ability. It dramatically reduces.
There you go.
But the magnesium L-threonate drives up memory and learning. I was going to say.
I was just going to say. I've lost my train of thought now, Steve, because we went to go at the same time.
If you're going to get pissed, have magnesium L-threonate.
That's right.
I hope you were
was going to say, don't use this as an excuse to get drunk and then take the magnesium threonate.
Absolutely.
But what I was going to say is it just shows how powerful it is in the effect it has on the brain, even with the alcohol on board, how it can still alleviate those symptoms. So it's very powerful, and that just shows that it is very good at getting into the brain.
So isn't that remarkable? I mean,
that is actually really remarkable, and I think the gut factor is really cool with that. Like, really cool.
You've heard of alcoholic gastritis. That's one of the terrible things that alcoholics get, and it alleviates that because it helps with the good bug growth.
So good, isn't it?
So, I mean, really good. Now, we'll leave the rats alone for a bit.
Yeah, let's leave the rats for a little bit now.
Humans. Humans, unfortunately, when they develop cancer, they need huge amounts of opioids pain relief because you can't. Opioids work in the brain by blocking, the receptors for pain in the brain. So wherever the pain is, it blocks it. You were talking about opioids before, endones and these sort of things, which is what they classically give people with cancer, or they give them IV. And in this study, they were on IV cancer. But what they did was they gave two groups of people with advanced cancer. There's 116 people in this trial. They gave half of them magnesium-L-threonate, and the other half were just on and opioids.
Yep.
And of course, remember if you've seen on the movies, it shows where people can give themselves morphine just up to a certain level. They won't overdose on it, but they click themselves, so you can measure how much morphine that people need.
Yeah.
So the ones that were given magnesium-L-threonate needed less opioid pain relief.
Wow.
So this relieves probably one of the most severe pains around, apart from, as well as migraines and that. They're all terrible pains. Magnesium-L-threonate is brilliant for reducing any sort of pain in the brain because it just down-regulates the brain like an opioid. Yep. But guess what? Magnesium is addictive. We need it every day anyway. We're already addicted.
And it doesn't have the side effects that the prescription, a lot of the prescription medications do. So if you can get the results from magnesium, then why wouldn't you try it?
Yeah. The study concluded by saying that magnesium-L-threonate outperforms the placebo in enhancing the analgesic effects of opioids and reducing the necessary opioid dosage. So they need less of it. But more than that, the magnesium regulates the bowel and helps the bowel. Yeah. The magnesium can significantly relieve opioid-induced constipation.
Because that's a big problem.
Opioids cause horrendous constipation.
Yes.
In the 70s, with children with diarrhea, one of the treatments was opium tincture.
Really? Well, I guess that makes sense, doesn't it? I mean, I had someone close to me was on opioids recently for quite a few days for severe pain.
Wow.
And, that they didn't go to the toilet for 4 days. Oh. I don't know how they function, to be honest, but it's terrible. It's a terrible constipating drug. Yeah.
Absolutely. So, and you imagine the advanced cancer patient typically not running around doing, not eating. They're just unfortunately advanced cancer patients. These people were classified as terminal. So, in that study, so that's absolutely incredible, isn't it?
So, it is really impressive.
I mean, from Alzheimer's to pain. To
brain
inflammation.
Did we talk about the brain cognition in the
the Chinese
journal?
Yeah, absolutely.
So improves,
that's with the vitamin C, vitamin D, phosphatidylserine, and the magnesium-threonate. That's that one.
Yep, because I was listening.
And that one's the neuropathic pain. Remember, people on GABA. Yep. So it really is a great pain medicine.
Yeah, really good.
We haven't talked about that one yet.
So the Orotate. So we haven't moved on to Orotate.
Not yet.
Not yet.
It's the next one.
Are we still going with the L-threonate, or we've got a lot of stuff here?
We have got. So we'll just summarise. The magnesium-L-threonate's for the brain. It's got anything with pain.
Brain-related.
Anything, learning it helps with sleep, relaxation, and it helps with any sort of pain disorder and inflammation disorder.
Yeah. We couldn't find much on depression.
No.
But I'm going to trial this for mild to moderate depression, obviously not severe depression, but mild to moderate depression because there is an element of brain inflammation in depression as well. So I'm going to see how that goes in clinic as well. So it could possibly be beneficial there as well. We haven't found a lot of studies yet, but that's only, as you said at the start, because it's quite a new form. So
I'd go out on a limb and say I reckon it'd help be beneficial anyway, because firstly, magnesium doesn't interact with medications because everyone should be on magnesium or eating it or drinking it or whatever. So, but secondly is, remember what drugs deplete magnesium?
Yeah, a lot of antipsychotics and
antidepressants,
things like that. Yeah, and that's one challenge in clinic is I see a lot of patients who have a lot of medications for whatever reason. And it makes it very difficult to prescribe because of the contraindications with a lot of medications.
Sure.
Magnesium is always one that I can always prescribe.
Exactly.
And with having the threonate, I'm going to see how that goes with a lot of these, low moods and depression and things like that to see where we get.
It's really cool form, isn't it?
It's really
It needs to be more popular though.
Yeah, it's just not the most, well, it's relatively new, I guess, in Australia. It hasn't been around for a long, long time. I think that's just people just don't know much about it, but it is an amazing form. Literally, look at everything that it does.
It's probably, like, my brain is all right at the moment, but certainly I take this at night. But what I'm also interested in my body, and this new form of magnesium you mentioned, Orotate.
Yeah.
Absolutely brilliant for your body.
Yep.
And absolutely brilliant for things like your heart.
cardiovascular.
Now,
yeah.
There's so many benefits for this, but I just want to click off with one study in the Journal of Hypertension. Guess what? You won't believe what this is, what this magnesium treats. You know, but I'll just read the conclusion.
Okay.
In conclusion, additional therapy with magnesium orotate is safe and can be an additional benefit for a patient with hypertensive heart insufficiency. So they get this when people get chronic high heart disease, and hopefully you don't get there. Hopefully you've treated earlier.
Yeah.
But your kidney function becomes, everything becomes screwed up, and your heart, you eventually die of a heart attack.
Yeah.
Magnesium orotate benefits those individuals. So it's absolutely remarkable. It's a small study. But certainly this can really help with that condition. So,
yeah.
I mean, what a cool thing to do. Yes, it reduces hypertension, but it helps the heart function.
Yeah, another interesting one I'm going to try.
Yeah, go.
I'm seeing a lot of AFib in clinic, atrial fibrillation.
Yep,
You can't say fibrillation. You say it.
Atrial fibrillation.
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 There's another word I was trying to say the other day at home, and I could not for the life of me. I can't say it. Oh, no, that's that. I say that all the time.
Sorry,
Sashi. Shashies. My partner's going to laugh.
Sashi.
You know the frame the car's built on?
The chassis.
I'm making myself look dumb. I can't say it.
You can't say chassis.
I cannot say sashi.
Chassis.
I'm going to stop because I make myself look an idiot. I can't say it.
Can you say sushi?
Sushi.
Oh, yeah.
I can say sushi, Susie, snoozy. Snashy. I can't say.
I'd love you to go to the mechanic and say, I think I've got a bent sausage.
I try. I don't know what it is. I don't know what it is, but I can't say it. I know what sashi is.
A fascist is someone like Mussolini in World War II. Is that what you meant?
But anyway, back to atrial fibrillation.
Yes.
The
atrial fibrillation is quite common as you age.
It is quite common,
And the
yeah.
atrium is the top part of the heart, and it becomes rapid thing and can throw clots and can kill you.
Yeah.
So, sorry, go on.
No, that's all I was going to say. I'm seeing it quite a lot in clinic, and I have a theory, but we won't talk about the theory.
What's the theory?
But this is another one that I'm going to try now as Orotate because obviously it's not going to fix the AFib, but it's very supportive of the heart. So we have a lot of studies on it for the heart. So, yeah, really good one for any heart
This one's
support.
A really, really good one for the heart. Yeah, this is obvious for the heart. All the papers are pointing to that.
Yeah.
Reduces blood pressure, everything. I've got one other thing here that will sort of surprise you a bit. This is magnesium orotate and the microbiome gut-brain axis. So, I mean, there's a beautiful paper in Nutrients. Oh, there's that paper I was looking for. I was flicking through it. I mean, it was awesome. So this one was published in Nutrients 2022. And what they found here is that this form of magnesium also helps the gut microbiome. Yeah. So really, really good here. And this review talked about all the interactions on the gut-brain barrier. And there's a paper on page 5 of this. There's a chart that looks like that.
Yeah, we love a chart.
Yeah, and what it does is it shows the difference between the brain affecting the gut and the gut affecting the brain. So with this, with Orotate in mind, Orotate is extremely good for the gut microbiome as well. And being good for the gut microbiome, it goes on and affects all those brain chemicals.
That. I mean, we did a podcast on the gut, on mental health in the gut.
Yeah.
And sort of highlighted the gut-brain axis.
Yep.
And how important it is.
So, like, if you have good bugs that, like lactobacillus, people have heard of that. It increases GABA, which is the thing that relaxes you at night, and brain-derived neurotrophic stimulation, brain-derived neurotrophic factor, and vagal stimulation.
Yeah.
And also, bacillus increases serotonin.
Bifidobacterium, very good anti-inflammatory as well, all that sort of thing. So, yeah.
GABA.
Great. Yeah.
I mean, it's so this stuff's great for your magnesium orotate is great for your gut.
Yeah.
Which is great for your brain.
Yes.
So it's sort of like, is it a brain one as well? It kind of is.
It is a brain one.
And you've got to remember that they're getting these two, you can take these two together.
Yeah.
They are not toxic.
You can.
Well, but isn't that remarkable? That's good for the microbiome.
Yeah, it's great, isn't it?
But probably my favourite study is this last one here.
Yeah. I can't keep up. I don't know where the pages are.
It's this one.
You can do it, Steve.
I'll read you the title and you'll love it too.
Okay.
This title is called The Effects of Magnesium Orotate on Exercise Tolerance in Patients with Heart Disease.
There you go.
So They picked heart disease patients because they're very intolerable to exercise.
Yeah.
Because their heart's screwed.
Yeah.
They gave them magnesium orotate, and their levels of exercise increased dramatically.
Wow.
So the magnesium orotate works directly on the heart to improve its function, even in people with coronary heart disease.
Wow.
So, it's just absolutely remarkable for anyone that has any sort of cardiovascular disease.
Yeah.
So I mean, the orotates and the threonates too we're talking about, we're certainly not saying they're the only two.
No. I mean, then we've got another couple of favourites.
We
as
have.
well. So we like glycinate.
We love glycinate.
We love glycinate and we love citrate. So
they work a bit differently because
They
the
do.
glycinate gets into the body quite well,
Yeah.
and gets into the cells. The citrate sort of saturates the tissues with magnesium, which is also very beneficial.
yeah, I think it's about 80% absorption of the citrate and about
Yeah.
90% of the glycinate. So glycinate is very good for anxiety, things
Yeah.
like that. So the citrate, the glycinate, and then if you would add something like the L-threonate and the orotate, what a powerful mix that would be,
dreaming,
because you're
aren't you?
kind of covering all bases,
Yeah.
really. And you can, as you said, you can put them all together.
Yeah.
So you can be working on your different areas, different systems at the same time.
And magnesium is literally non-toxic,
Yeah.
because you literally need it
Yeah.
every single day.
Yeah, so
If you-
as you say, around about 300 milligrams a day,
Yeah.
3 to 600 in split doses,
Yep.
depending on where you're at. It's fine.
And maybe we're doing the bow too far as getting 4 different types of magnesium, but seriously, if you can get those 4 and somehow work them into your diet and lifestyle, you're going to be way better off.
Yeah.
Because, we just picked 2.
Yeah.
I mean, because the podcast will be here for hours and hours on end. But you remember, magnesium, we'll recap, essential, you need 350 milligrams a day. You use it through the pee, about a third of that goes.
Yep.
You lose it if you're stressed, you lose it if you're on drugs, you lose it if you drink, you lose it if you eat a crappy diet,
Yep.
depleted soils. Magnesium's gone, you need it every day.
You
So
definitely need it.
unless you're a magic eater that's eating all these beautiful green leafy vegetables and loads of, mixed
From
nuts.
great
and-
soils that's not depleted,
yeah,
wherever that is.
exactly. As I said, we pick on the mixed nuts that I bring in here, but they could have been grown in magnesium deplete soils.
They could have been,
I
yeah.
don't know. They taste great,
Yeah, they do. They taste good.
but I mean, the orotate and the threonate deserve more attention and deserve more science.
And I think you'll start to see more about it as more is learnt about these.
Yeah.
But as I said, they're not as easy to find, but if you can find them, and if you can find them in a mix with our top 4
Yeah.
favourite magnesiums,
Yeah.
then you're covering all bases. You're working your nervous system function, your brain health, cardiovascular system health, your gut health.
Yeah.
So
gut health.
Yeah.
These 2 things are very good for your gut.
Yeah.
I mean, we think of, polyphenols and all this stuff you gut, and they do, but these 2 things on their own give you magnesium and give you gut health.
Yeah.
Even the threonate one we picked on for the brain,
Yeah.
it's actually good for the microbiome.
No. It's good, isn't it?
Oh,
Yeah.
And you're going to be taking a magnesium form anyway. Look, let's just be really sort of going to take a shortcut here, but let's say that you're stressing and you have trouble sleeping. I'd go for the threonate. If you're a severe exerciser and you want to get your heart health going good and blood pressure regulated, then maybe the orotate ones.
Yeah.
The magnesium glycinate is good to have with foods
Yeah.
that you can take at night to help you sleep. That's very good. And the magnesium citrate is a good all-round supplement to
Yeah.
get the body up to 80% absorbed.
Yeah.
But that's, you could pick that to bits and say, but the threonate's good for the gut. So if you've got gut problems, you get, so
They
it
all
goes on
cross
forever.
over a little bit, don't they? But they all cross over a bit, and then some have their specific roles as well. So cardiovascular.
Final
health.
question.
Yeah.
Put your practitioner hat on.
Okay.
How many people do you see that you suspect are magnesium deficient?
Oh. Well, how many people do I see that are stressed?
Yeah.
90%.
Oh, okay.
90% of the people I see have a lot of stress.
Yeah.
So I would say, for the most part, most of them would be at least have some mild magnesium deficiency. And like I said, I probably prescribe magnesium for most clients. So because everyone can benefit from it, no matter what.
Yep.
So that's usually my first stop is magnesium. Everyone can benefit from the magnesium. So, yeah.
I
Can't
know.
say anything
And you
more
just
about
have-
how good it is.
You just have to pick which one's best for you.
Yeah,
Cool.
Yeah.
Well, on that note, we should leave it. We've run out of time.
we have.
We'll see you all next week.
Yeah, thanks, guys.
See ya.